Good evening, guys. This is Discussion C for you. We're going to discuss communication between doctors and patients for pain management, pain control, and things of that nature. So let me get set up for the show and I'll be right with you. Give me 2 seconds, please. Okay, let me back up so I can see. So everybody can see me. Instead of that, sitting close to the desk. Okay. This study highlights the crucial role of effective communication between doctors and patients in managing chronic pain, led by Charlie Thompson, a communication professor at University of Illinois, Urbana-Champaign. The research examined 200 adults suffering from chronic neck or back pain. The findings suggest that strong physician and patient communication during initial consultations helps patients cope with uncertainties, including fears, anxieties, and confidence in managing their condition. The study identifies 2 key communication processes. Okay, informational competence. Okay, patience, accuracy, describing symptoms, understanding doctors' explanations, and doctors providing clear instructions. Okay. Social emotional compliance, establishing trust, open communication, and emotional support from physicians. By fostering hope and self-efficacy, effective communication can reduce distress and improve pain management outcomes. The study was published in the Journal of Health, Communication, and Alliance with Uncertainty Management Theory, which explores how individuals handle uncertainty regarding health conditions. The implications of the study are significant for both patients and doctors. For patients, improved pain management when patients communicate openly about their symptoms and concerns. They receive clearer guidance leading to better pain management strategies, reduced anxiety and uncertainty, effective doctor-patient communication alleviates fears, empowering patients to navigate their condition with confidence, enhance trust and support, strong social emotional connections with physicians, foster hope and self-efficacy, which can positively impact overall well-being. For doctors, better diagnosis and treatment planning, understanding patients' needs through effective communication allows doctors to tailor treatments more accurately, increase patient compliance, patients who trust their doctors and comprehend medical procedures or medical advice, are more likely to follow treatment plans consistently. Okay. Stronger doctor-patient relationships. Clear and empathetic communication enhances patient satisfaction, leading to more positive healthcare experiences. The study reinforces the uncertainty management theory, suggesting that reducing patient uncertainty through strong communication leads to better health outcomes. This encourages doctors to prioritize interpersonal communication alongside clinical expertise. Would you like guidance on how patients and doctors can further strengthen communication in practice? Improving doctor-patient communication can significantly enhance healthcare experiences and outcomes. Here are some key strategies that can foster more effective interactions. For patients, be clear about symptoms. Provide detailed descriptions of your pain, including intensity, duration, and triggers. Ask questions. Don't hesitate to seek clarification about diagnosis and treatments and side effects. Express concerns. Share anxieties or uncertainties about your condition to receive appropriate support. Take notes. Jot down important details during appointments to ensure you remember key information. Okay, use a trusted advocate if needed. Bring a family member or friend to help communicate your needs. For doctors, practice active listening. Show empathy by listening attentively and validating patients' concerns. Use clear language, avoid medical jargon, and explain conditions and treatments in an understanding way. Encourage open dialogue. Foster a supportive environment where patients feel comfortable asking questions. Provide written summaries. Give patients accessible materials to reinforce key points from consultations. Check for understanding. Ask patients to repeat or summarize medical advice to ensure comprehension. By implementing these strategies, both patients and doctors can build trust, reducing anxiety and improving health outcomes. Would you like tailored communication techniques based on specific medical conditions? Okay, guys, now we're down to improving communication for mental health issues. Okay, requires sensitivity, clarity, and emotional support. Here are some effective strategies for individuals seeking support. Practice active listening. Show empathy by listening attentively and validating emotions. Use statements. Use I statements. Express feelings without blaming other. Example, I feel overwhelmed. Instead of you never said. Be honest and open. Share struggles without fear or judgment. Vulnerability fosters connection. Seeking professional guidance. Therapies can provide structured communication techniques tailored to mental health needs. Set boundaries. Communication or communicate personal limits to maintain emotional well-being. For mental health professionals, encourage open dialogue. Create a safe space where patients feel comfortable discussing their emotions. Hold on, folks. Got too stuck. Use clear, simple language, avoid jargon, and ensure patients understand their diagnosis and treatment options. Validate feelings. Acknowledge emotions without dismissing or minimizing concerns. Incorporate nonverbal gestures. Maintain eye contact. Use reassuring gestures and adopt a calm tone. Provide written resources. Offer accessible materials to reinforce key points. from therapy sessions. For friends and family, other support without pressure. Let loved ones share their own peace of mind, folks. Avoid judgment responses. Refrain from dismissing or invalidating their experiences. That matters, folks, because if it's a mental health person who's coming to you for advice or needs you to write them out a prescription for something, and they're trying to get their point across to you as a patient, listen to them and do not judge them for their disabilities or conditions. For them, for mental health patients, it's hard enough getting how they feel out to you as doctors. Okay. Next page. Encourage professional help. Suggest therapy or counseling when appropriate. Check in regularly. A simple "Hi, how are you feeling today?" can make a difference. Respect their needs. Some individuals may need space, while others may seek more interaction. Communicating with children about mental health requires patience, clarity, and emotional support. Here are some effective strategies for parents and caregivers. Use age-appropriate language. Explain mental health in simple terms that match the child's developmental level. Guys, it's like having a dementia patient who slips backwards, but they come to us as aging specialists for questions. Our job is to tailor the answer in appropriate ways so they understand things. Okay. Use appropriate language. Explain mental health in simple terms that match a child's development level. Okay. Or in some cases, that works for elderly folks too that have memory issues or that are sliding backwards. Communication works, folks. You just have to go down to their level. You have to figure out what their level is and meet them on their level to communicate in the right way. Okay. Normalize emotions. Teach children that feelings like sadness, anxiety, and frustration are normal and manageable. Encourage open conversation. Create a safe space where children feel comfortable expressing emotions. Validate their feelings. Acknowledge their emotions without dismissing or minimizing their concerns. Model healthy coping strategies. Demonstrate ways to manage stress, such as deep breathing, journaling, or talking to a trusted person. For teachers and mentors, incorporate mental health education. Use stories, activities, or discussions to introduce emotional well-being concepts. Recognize warning signs. Be attentive to behavioral changes that may indicate mental health struggles. Guys, this works for people with dementia also. Like I said, for you to communicate with the dementia patients, you have to step in their world for a couple seconds to see where they're at as a person, not just a client. You have to treat them like human beings, folks. Okay, and encourage peer support. Foster a classroom environment where students support each other emotionally. Provide resources. Share books, websites, or activities that help children understand mental health. For healthcare professionals, use gentle, reassuring language. Avoid medical jargon and explain mental health conditions in a way children can grasp the situation, folks. That's like an elderly person too. You have to explain things in plain English for them to understand. And like I just said, if it's a dementia patient, you have to take them aside in a quiet room with you and them, and just sit down and explain to them what the situation is, or redirect them. It's much easier than screaming at somebody. Okay. Okay. Use gentle, reassuring language. Avoid medical jargon. Explain mental health conditions in a way children can grasp the concept. Engage through play and art. Activities like drawing or storytelling can help children express their emotions. Okay, empower children, teach coping skills, and encourage them to take active role in their emotional well-being. For more guidance, you can explore resources like NAMI, a guide to talk, on talking to children about mental health, or child psychiatry today, for effective communication strategies. Would you like tips on handling specific mental health concerns, such as anxiety or depression in children? There are several excellent resources available for children's mental health education. Here are some that might be helpful. National Institute of Mental Health, or NMH, offers videos, coloring books, quizzes, and okay, hold on. Fact sheets to help children understand mental health concepts in an encouraging way. Children's Mental Health Matters resource library provides toolkits, activities, sheets, and coping strategies tailored for different age groups. Child Mind Institute Family Resource Center features parenting guides symptom checklists or symptom checkers, and expert advice on supporting children's mental health. And then you have behavioral health resources for children and families, includes crisis line indicators or locators, developmental screening information, and guidance on trauma and depression. Would you like recommendations for age-specific mental health activities? Okay, guys, I thought that would be good for tonight. So, I will see everybody tomorrow for shows. For now, Gator Wellness. Take care, folks. Everybody have a good night.